And so, thankfully, these people had some resources and connections with the Bureau des Avocats Internationaux, where they could, try and defend themselves effectively. Unfortunately, I believe they lost their camp, Django, and others have been closed as well. It's an ongoing and serious problem, to the point where the Office of the High Commissioner for Human Rights of the United Nations has now made several formal declarations saying, stop the forced closings of camps. It's against basic international human rights standards and laws and the rest. And so it's good that the office has done this, but it hasn't stopped the mayor of Delma and other examples that I could tell you about from beginning this move to try and close down the camp so that basically they don't have to deal with the problem anymore, but also if it's a better off part of Port-au-Prince and they don't have to see people living in tents and shelters by the sides of the roads. And this is another important aspect of the situation in Haiti that I spoke about earlier. These are women organizing against sexual violence. Some of them are camp residents, some of them are assisting the camps, but these are very tragic stories. And one of the reasons why this is happening is that the policing of the camps and the leadership role by the government is not effective enough, and people have to take matters in their own hands. This is the office of COFAVIV, which is one of the women's rights organizations that's doing very important work in this regard in educating the public, educating the police and the court system of how they have to take this problem seriously, and also assisting women in basically defending themselves in their daily lives in the camps or in their neighborhoods. And so it's an ongoing challenge and problem for social life in Haiti. I'll say a few words about the healthcare situation. Lots of aid poured into Haiti, of course, after the earthquake, and some of the most successful of the aid that was delivered was in the field of healthcare. And that's because you had effective health organizations already on the ground in Haiti. Partners in Health, Doctors Without Borders, Cuba's Medical Mission. They were already there doing effective healthcare work, so they were able to kind of respond fairly quickly. And of course, other resources came into the country. But it hasn't built a public healthcare system in Haiti. And what we're seeing, in fact, is a regression now. All of those resources that went into what you could call the public institutions of healthcare in Haiti are now becoming less and less available. And this was an example. This is the hospital in Léogâne. And it's a fairly new facility, and it's a fairly large one as well. And I'll go back to the map here of Léogâne. It serves a pretty big area surrounding Léogâne, which is over here on the left of the map. Probably, I'm guessing, 500,000 people would be served by that hospital. And so we were taken through the hospital by the doctor on duty, and he showed us that about 2/3 of the hospital is closed down because they don't have the money to operate it. The 1/3 that is open thanks to funding that the hospital receives from the Episcopalian Church of the United States. So imagine that, healthcare in what is the equivalent of a public healthcare institution in Haiti, first of all, is dependent on international funding from a church, and secondly, isn't enough to operate the institution anyway. The closing of areas of the hospital you see here is not just beds where people would stay. It's a lot of basic services. The lab in the hospital is not open anymore. Some of the more complicated surgery, people have to be shipped off to Port-au-Prince. And the Port-au-Prince hospital, the Hôpital Général itself, is going through this as well. Port-au-Prince's main public hospital is going through a regression as well. The funding and the services are not what they were a year ago. And so patients here that have to be referred to Port-au-Prince, they may not find anything better there. And we went through Léogâne, which received significant medical assistance in the first couple of months after the earthquake from Canada and from other countries, and we didn't see any evidence today of what that left the Haitian people. Canada's medical mission in Léogâne, which was largely delivered by the Canadian military, only lasted 2 months, and there's nothing there to show for it today. This is the cholera treatment center that the Canadian Red Cross established in Carrefour, which is one of the 6 municipalities of Port-au-Prince. I'll go back a couple of slides and show you the map back to the map. There. Carrefour is kind of the western edge of Port-au-Prince. It's a very large area, a very poor area as well, just a little bit kind of better off than Cité Soleil. Probably 500,000 people there. So we'll go forward again. So this is a cholera treatment center that was established in Carrefour, and there was probably 6 to 10 of them when the cholera first broke out, because this is an area that's very vulnerable to cholera because of the lack of potable water available. And that's great that the Red Cross did this. This was established in early December. So I decided to go there to check how it's doing today, and we found this. It's not there anymore. This was June 28th that we were there on the site. And yet, before I went to Haiti, I had read on the Canadian Red Cross's website that they had transferred the authority of this cholera treatment center to the Haitian Red Cross. So we thought we were going to visit a model Haitian Red Cross cholera treatment center. And this is what we found. And I have not been able to get an explanation from the Canadian Red Cross as to why their website said this. And if you want to read what the website says, there's the relevant quotes. We deployed a field hospital at Carrefour. The end of March, we transferred it over to Haitian Red Cross. It's pretty clear what they're saying here, I think. Now, what I was told was that by the Haitians that is there, they said, well, we understood that they opened a cholera treatment center in a different part of Port-au-Prince. And there may be an argument that with resources being what they are, that there was a case to close the cholera treatment center in Carrefour and reopen a center in a different part of the city, perhaps in greater need. But that's not what's on the website. And they didn't give me that explanation on the phone either. I think it's, there's an issue of accountability and transparency in what the aid organizations are doing in Haiti that's very important. And in the case of the Canadian Red Cross, it was the largest recipient of earthquake relief funds. And I think Canadians deserve better information from the Red Cross, not only about what the Red Cross is doing, but what are the needs in Haiti? The Red Cross is there working on the ground. They should be telling Canadians. Really, it shouldn't even be up to us. Why is it up to us to tell Canadians what's going on? Hey, we pay out of our own pocket to go down there and find out this stuff. Well, isn't that what the agencies are supposed to be doing? Isn't that part of their mandate so that Canadians can become aware of the needs? And maybe, you know what, maybe we need more assistance. Maybe Canadians should dig deeper in their pockets. But we don't have the information to decide that, and it's not acceptable. And as a matter of fact, Doctors Without Borders maintains its cholera treatment center in Carrefour. And they say that Carrefour is one of the areas in Port-au-Prince the most vulnerable to cholera ongoing, because the cholera epidemic in Haiti is by no means under control. It's a very perilous situation still. So, but as I said, there are medical agencies doing important work. This is on one photo there. You have the cholera treatment center operated by Partners in Health, and in the upper left-hand corner is the new hospital that they're opening. It's the second training hospital that Partners in Health will open in Haiti, in Mirablais. It'll be open next year. And these are, this thing is worth its weight in gold or more, because this training hospital means Haitians being trained to provide health care to Haitians, not foreign doctors having to come in as much as that is needed. This is Haitians developing public health care capacity, and that's so important. And it's the thing about the Partners in Health and also the Cuban medical mission that is so important in what they have done, is they are there to basically assist Haitians to create a public health care system. And that's the kind of aid and assistance that's needed in Haiti. It's what Partners in Health has been doing. And Paul Farmer, one of the co-founders of Partners in Health, has just written the first comprehensive book examining the earthquake, what happened during and after. We have copies of it here for sale. I encourage you to buy it and read it, because it's a tremendous story. But he tells the story. Why was Haiti so vulnerable in the first place? Why did so many people have to die? Why is there so little capacity to respond to the earthquake emergency? Well, it's all rooted in history, and he explains that very well. But that's an outstanding medical organization that provides people with the basic know-how that they need. Not just give us money, but here's what we're going to do with it. Here's why we need it, and here's what we intend to do in Haiti so that Haitians aren't so vulnerable to the next natural disaster that happens. These are educators, community educators of Partners in Health, going around with cholera prevention information. And this is a map of all of the medical centers that Cuba has established in Haiti, everywhere in the country, except they're not in the biggest cities, because in a sense they're not needed there. A lot of the big agencies, it's easier for them to operate in the bigger cities. And of course the Haitian government, to the extent that it has healthcare facilities, they're better in the bigger cities. No, Cuba goes to the areas that are most difficult to reach, where the need is the greatest. And it's a tremendous story. This is actually an old map. I'd like to get a newer one, because I think the network you would see there, the red dots, would be even more extensive than what we see there. But it's a tremendous story of internationalism that's gone on for some years now with Cuba, with Partners in Health, and I would say to some extent with Doctors Without Borders as well, although they don't do the same degree of training that the other two agencies do of Haitians to become medical professionals. We attended an important convention of the the Autonomous Confederation of Haitian Workers, the CATH. It was a 3-day convention that they held, a good step forward for that union. Serious discussion there about the role that unions can play in struggling for social justice in Haiti. They have a very important role to play, and there are a number of union organizations in Haiti, and we're very much hoping and working with the unions in Haiti to strengthen their unity and their capacity to fight on behalf not just of their dues-paying members, which they don't have a lot of in Haiti given the economic conditions, but for the whole society. And CATH, as well as some other unions in Haiti, have received important assistance from unions in Canada, including the Canadian Union of Public Employees, the Public Service Alliance of Canada. Those are two in particular I can think of, but there's others as well. And this is very important to continue and deepen in the months and years ahead. And also human rights organizations. This on the left is Mario Joseph. He is the director of the Bureau des Avocats Internationaux. That's the Office of International Lawyers. It's been around in Haiti for about 20 years, and it plays an extremely crucial role in assisting Haitians to defend themselves. Yes, they are a legal service, but they have resources that are available to Haitians to themselves get organized and better defend themselves. And I showed you a photo earlier of that protest action by the residents of Camp Django. Well, they were able to use the facilities of the Bureau des Avocats Internationaux to hold a press conference, to be able to communicate to the outside world with internet, use phones, all these things. And I spent several days in and around the offices of the BAI, and it's just a beehive of activity. There's people from every cause you can think of, women's rights, trade unions, camp residents who are able to work with the BAI, and some of its partners, both Haitian and international. Very important center of activity that goes on there. This, for example, was a meeting of the former employees of Teleco, the former state-owned telecommunication company. They lost their jobs, were not compensated for it, so again, they're able to work with the BAI and trying to fight for proper compensation for loss of their jobs.